Hello there. Welcome to another episode of Medics in Tech podcast. My name is Gabriel Okay, and on behalf of everyone at Medics in Tech, I welcome you to today's episode. On today's episode, I have an awesome person in the studio. Her name is Ilda Kafo, and she will also tell us a little bit more about herself before we go ahead. So today, we'll be talking about product design, how she's been able to combine her background in physiotherapy with product design, involvement in tech so far, and just talk tech and health as we used to on the call every time. So now, Hilda, over to you. So who are you? Who is Hilda or Kafo? And then a little about yourself, your undergrad, then your tech background.
All right. Thank you very much. Thank you for having me here. So my name is Hilda Okafo. I am a physiotherapist. I'm also a product designer specializing in the health technological space. And my journey started off way back in my undergraduate level. So I am the kind of person that actually love interface, and I decided to go take a design course. So with that, I was curious to how design can actually help bridge the gap in healthcare problems that I experience. So some of them were like patients forgetting their exercises, not actually doing the exercises the way that it's supposed to be. So it reduces their quality of life and the rate at which they stay in the hospital. So I decided to like, okay, I need to go down this path. I wouldn't say I'm not that a clinical person, but I really love to engage with technological space. So that was how I started. And um yeah, it's been going to 4 years now in design and fully transitioning into digital health. Yes, thank
Okay,
you.
nice, nice. And can you give us, so we understand that for your physiotherapy now you had to do an undergrad program, but can you give us more um, explanation into how you got into the old tech thing? How did you start? What were the first things you did? Did you speak to people? What people you spoke to? Just to understand your journey.
Okay, yeah, it was an interesting one. So I started off while I was in preclinical year. So I decided to start with graphics design. I was like, oh, I'm not doing anything. So I needed to learn a skill. So I started with graphics design, then moved into UX design during the COVID period. So that was when I fully started design during the COVID period. And I didn't really meet people. Like I was in a lone phase at that moment, and I had to, okay, let me try out this, explore this kind of design. So I started off with that, and around that line, I saw a lot of women in tech programs, so I decided to apply. So out of them, I got scholarship for the Women Tech Star, the 2022 um, fellowship. And I also got into the Asha Koteri in collaboration with Carrywise design um, fellowship. So that gave me a kickstart into product design, and I've really learned a lot from there. So from that instance, I went to meet my head of department, so Professor Adesola Odole. So I told her about my interest in digital health, in telerehabilitation, and she's someone that have a lot of research papers in that. So she gave me that as insights. So I started with that progress. So from there, she introduced me into remote monitoring system. Like, okay, you that help me bring out problems you think that design can solve. So we worked on the drafts and submitted. Then were selected. So this project was actually in line with the University of Ibadan Biomedical Research and the RISE 360 Global Technologies. So it's actually helped me in understand how digital health implementation works, how to research on that too. So that was how it started.
Yeah.
Yeah.
So you mentioned something there, telerehabilitation. So can you explain more about that? Like what does tele-rehabilitation entails? And let's say you were to explain to a teenager now, how would you explain?
Okay, so tele-rehabilitation entails online consultations. So we are trying to bring these physiotherapy practices or treatments via the online routine. So we could use the linearest format. WhatsApp can be a linearest format for tele-rehabilitation as far as you have your video, your audio, and you have clear exercise description. So that works.
So if I understand you, someone that needs physiotherapy now, you will have recorded the video or maybe a live session, and then the person can you can transmit that while the person connects on WhatsApp. Is that
Yes, we can do both. We can do both the live connection and a pre-recorded video, right? But I think the live session would entail more activities and chance to ask questions, feedback, and all. So yeah.
okay? So I think the next question should be around human-centered design. So I see that you have some experience about around that, and you're also passionate about human-centered design in healthcare solutions. Cool. I would like you to describe that, but also when you're doing that, maybe you can use an example to describe that so that it's easier to relate for what you're saying. Because now tele-rehabilitation, I'm trying to make it very easy for people to understand, you know.
Yeah, thank you so much. Okay, so for human-centered design, this is the aspect whereby we take the users into consideration. So the users are king, and combining that with my clinical experience. So I, for one, I already know what it is like to be a clinician. I know what it is like to experience the downside in the clinic. So coming up with the same experience from user experience, this can actually help me translate it to a simpler version. So the thing is that for digital health products now, we are looking out for adoption and the correct way of implementation. So if we don't get that right, I mean, we just build product and people are not using, people are not understanding. And in this process, too, we also take into consideration trust and the data of patients. So how are these data being used, and how can we translate them to the patients that this is what we are looking out for in their health and all. So that's that for me. Simplicity, transparency, and ethics and data.
Yeah,
Yeah.
yeah, I see that you have I think you have a write up around ethics, and I'm still going to talk about that. But now let's look at your newsletter, Health Cape UX. So can you why did you set that up, and what are you trying to do with that? And is it successful so far?
Okay. Okay. I've had this goal to start my presence on digital health for long, but I decided to start this year. So starting with the newsletter gave me a perspective to putting down my own learnings, my journey into this category of healthcare. So, so I'm just using that to put my journey, insights, trends in particular as regards design, healthcare, and technology. So I'm just trying to put out content there on what I've learned so far and what others too can also learn from that. Yeah. So I think with time, there's a future for it. Yeah.
Okay.
Thank you.
So I think you've talked about some reasons why some groundbreaking health research and maybe products die very soon, why some of them don't last. So can you talk more about that?
Okay, so while I was writing that, the perspective was to give reasons why some of these researches are not being used. So I mean, there are a lot of research articles out there, and we are practically not using the insights from those research papers. So that was why I wrote that. So in that instance, when we have research on digital health technologies or digital health tools, there's also need that you have an experienced designer to also navigate through that insight so that there'll be proper adoption and simplicity inside. So that's that. So collaboration with the clinical researchers, collaboration with the UX designer. So it's very important. Yeah.
But sometimes there's a lot of disconnect between clinical personnel and the people working in the clinical setting generally, and the people that are building
Yeah.
solutions. So everyone is going on their own and everyone think they are right. So it's always good to work together to provide solutions.
And most times it's also advisable that healthcare providers also dive into
Yeah.
such.
Yeah.
So as healthcare provider, also try to learn something on tech to assist
Mm.
others to, yeah.
Okay, so let's talk about some of the things that excite you, some of the discoveries that excite you currently in the tech space, or maybe generally in the AI, machine learning, or generally the digital tech space. So kind of give us some of the things that kind of excite you. Maybe you've worked on them yourself, or you about them, you've read about them, or they are just like buzz, around and you can't avoid them. And also, you can also talk about things you think will be exciting in the future as well. In what do you think will be exciting? Is it AI, and what particular AI do you think is exciting? Is there particular research? Like what do you feel about it?
Okay, so I think the most interesting now is the artificial intelligence and how it is evolving. And this is a whole lot. This is a whole lot. And for me, I think the first the first thing to do is have a digital health literacy, because there are a lot of healthcare providers that are overwhelmed with all of these technologies that emerging. So we need that literacy aspect. We need that educative platform for them to learn about this. And I think another form is some of the healthcare professionals or some of us, we are resistant to change. We don't want to actually go to the new way. We want to stick to the old way. And I mean, change is constant. We have to evolve. And I think one thing about the artificial intelligence space is creating ethics for it, to know to the extent to which we can use artificial intelligence in healthcare, and also for data privacy, patient data privacy. So another thing is also that yes, we need to use AI to hasten up the process. So let's say for innovators now, you are building something, and I mean the process is still as complex, or you are still adding more process to the previously done techniques. I mean, we are not building. It has to be as simple as possible.
That's the importance of innovation, actually. And you're not just doing it for doing sake. It has to be solving a problem. And the major problem
Yeah.
is the complexity of say already. So if the complexity of a process is already a problem, and then you're not building on that complexity to add another technical activity. So I think I agree with you on that. So now let's come more on the professional development side. Let's say I'm a student, maybe I'm in clinical days of my undergrad as well, just as you started then. And I don't know, I'm just hearing AI everywhere. I'm hearing ChatGPT, I'm hearing DeepSeek, I'm hearing everything, and I'm thinking of what else I can add to my certificate. So I don't just graduate without any other thing. Let's say you can just do one or two first class or second class, I mean, whatever. What would be your advice to such an individual?
Okay. Okay. So for me is I would want them to actually to be clear on their purpose, like what pathway are they going for, and plan properly, whether a career roadmap, plan properly on it. Be curious to where you have interest the more, and seek advice, seek for mentors out there. So you don't necessarily have to contact them, but following what they do, following everything they do, and also implementing some of those things would go a long way. So taking courses too is very important on what you want to learn, either structured or a non-structured format. Or I would love a structured format because you get feedback immediately. You get to know more about that particular thing you are trying to learn. So that is that for me. And also we try to incorporate all of this into experience, do small project on it, try to showcase that this is what I can do. And visibility is your friend, honestly. Thank
Okay.
you.
Yeah, so now I have like two or three more questions and we'll round up everything. So describe your most interesting project so far in your tech journey. When you something you think about every time and be like, wow, I'm so proud of myself for doing that.
Okay, okay, for now. Okay. Okay, so one of the most interesting projects for me was the remote monitoring application I worked on. But currently now I'm trying to look into data visualization on disease trends and how it can be improved. So I looked out on its map and how um, there are a lot of things in it, and I'm trying to like look at ways to improve on the user experience of its map and how disease trends are being visualized. So I think that's my own interest right now. So this is more relating to public health, global health, and healthcare policies and how they can use these tools. So
Mm,
that's like my interest currently.
So let's come back. So we've talked about you now. So let's talk about Nigeria now. So what is what is happening in the Nigerian health space? I mean, digitally speaking, kind of interest you, or maybe something you want to be involved in, or something you're proud about. I know there's a lot of maybe new apps that are coming up, new companies, but for you, what will you say, does stand out for you? Like, okay, this I so much like this, or maybe a founder, I mean, whatever in the health space in Nigeria.
Okay, in Nigeria, I think there are lots of founders that are really trying their best, honestly, like Help Mom, the Wella Health, and there are a lot of founders trying their best. And also for the aspect of rehabilitation, Rehabilify is also trying from the aspect of physiotherapy and rehabilitation therapists. So I think that's for what I know about that. Okay, so for relating to physiotherapy, I think there is a lot to do, a lot to do. So the fact that I worked on a remote monitoring system, it wasn't implemented properly, and I had my lessons. I learned lessons from that, right? So there's also a call to build more on that. And in as much as the government has a huge role to play in the health space in Nigeria, there are things individuals like us can do. So, and I was thinking about open source because that's the best way to get people to start using some of these tools, making them open source and let collaborators come in to build. That's my own side of it.
Yeah, thank you so much. I've exceeded my questions already. So, do you have any other thing to add before we conclude this session? I think we've learned a lot about human centered design. We talk about your journey in tech. Are you able to combine physiotherapy with your UX experience, your US learning experience as well? So, yeah, it's been interesting. But for you now, what would be your advice generally to everyone watching, either undergrad, postgrad, or just any healthcare professional listening, or maybe even your fans as well? Like I do see that you have some followers on LinkedIn. Yeah, so what would be your final take?
All right. Thank you so much. So I would say that in whatever we want to do, we should just start and not think too much about it. Even in health tech, not relating to health tech, we should just start what we want to do. And we don't know who is seeing, who is viewing this. And I think that's going to go a long way. And having a curiosity mindset is very important. Then another thing I would like to add is be the type that learn from any and everywhere. Learn from people below you, above, in between, and also try to um, relate this with your colleagues to go alongside with them. So that's for me.
So thank you so much for your time, Ilda. I had a great. I think that
And
was.
you too. Thank you.
Thank you. So we can continue the conversation on LinkedIn actually. So yeah,
Okay. Okay.
take care of yourself. Bye.
Bye.